Hospitals and other health providers in Texas are now required to provide patients with an itemized invoice so they know exactly what they're paying for after treatment. The new state law comes after our investigation focused on Central Texas medical debt lawsuits. Many patients told us they could not get details on what they owed. As investigator Arezow Doost explains, the law went into effect in September and it's already making a difference when it comes to transparency.
0 days, SB 490 is finally passed.
Legislation pushing more transparent medical billing is headed to the governor.
So at the end of the day, a great bill is going to help every Texan.
As Senate Bill 490 became law, we tracked every step.
I was getting email alerts and I started to follow each stage.
So did Michelle Ledesma from Cedar Park. She was hospitalized for a severe bacterial infection in 2018.
I was sued for a bill that I received from a hospital, and I kept asking for the itemized statement. I never received it.
Now, hospitals and other healthcare facilities, including freestanding ERs, birthing centers, and drug treatment facilities, are required to give patients a written itemized bill before sending it to collections or trying to collect any money owed. The law says the itemized bill has to be in terms the patient understands and include medical codes and prices. It can also be issued electronically through a patient portal.
This was our crowning achievement. This is what we set out to accomplish day one. This was our priority for session.
State Representative Caroline Harris and Senator Brian Hughes worked together to pass the legislation last regular session.
How will you monitor that the law does what it's supposed to?
My team and I are already kind of getting ready to make sure that those hospitals and medical facilities are in compliance with it, and we're also ready to just figure out, hey, if they're not in compliance, why? You know, how can we help? Is there some issue with the language that we need to clear up?
The Texas Health and Human Services Commission will oversee the rollout of the law and compliance. The agency just published this guidance letter, which outlines provider responsibilities and expectations. HHSC is also primarily responsible for taking disciplinary action against providers in violation. In an email, a spokesperson says enforcement could include denying, suspending, or revoking a license, and administrative penalties ranging from $1,000 to $25,000 for each day in violation.
The other piece of this is that the courts can be involved as well. So a lot of these cases have gone to court where a hospital has sued somebody for not paying a medical bill. And so those judges and justices have the opportunity to say, okay, well, I know now that the hospital has to provide an itemized bill. Did you do that? You know, where's the proof of that, so that we can see if this charge is actually accurate or not.
The law is not retroactive, so it doesn't apply to cases before September 1st, like Ledesma's.
I would like to know what I'm being charged for, you know, and people make mistakes. Things happen. And I think this right here will help prevent some of that.
Ledesma says she eventually got an itemized bill in court and found discrepancies. She shared her story with lawmakers during the session, hoping to make a difference. She thinks the new law's already having an impact.
When I have gone to an emergency room or to a recent doctor, different type of procedure, I've asked for the itemized statement, and I've noticed I'm getting it faster. You know, and that's a good plus for us because we're able to see it sooner.
Arezow Doost for State of Texas.
The Texas Hospital Association, which opposed the legislation because of costs it anticipated, says it's been working to make sure hospitals know about the law and has been offering guidance so they're ready. As Arezow mentioned, we followed this legislation very closely to catch up on how we got here and how you can file a complaint if a provider is not in compliance. Click on this story in the Texas Politics section of our website. Thank you again for joining us for State of Texas. I'm Josh Hinkle, and we'll be back next week to bring you an in-depth look at Texas politics.